Hi, folks. Welcome to the PSYCKES training for hospital leadership. My name is Kristen McLaughlin, and I'm part of the Office of Population Health and Evaluation. And I should also be joined by some of our colleagues from the Office of Hospital Care and Community Transitions. And I'm very excited to have folks on the call today to talk through just how to implement PSYCKES at your hospital. So before getting into the actual details of that, I just wanted to talk a little bit about Q&A for today's WebEx. So you might have noticed that all phone lines have been muted in order to prevent background noise. However, folks are able to submit their questions using the Q&A box in the WebEx menu, which is located either to the right of your screen, or if you've expanded the view of the webinar to the full screen, you'll just need to hover your mouse over the top bar to make sure that you have the option to select more and Q&A from that menu option. We do request that questions are submitted using the Q&A feature and submitted to all panelists, just to make sure that we have the opportunity to record those questions, and we're going to save time at the end of today's training to get those addressed. Any questions that we're not able to answer live on air, we'll make sure to follow up with those individuals. And we do ask that folks do not use the chat function for Q&A, as that will not be monitored, and that today's training will be recorded, and the recording slides and additional training materials will be made available to those after the presentation. All right, so let's talk a little bit about the agenda. So we're going to start with why now, why PSYCKES, and then do a little overview of the PSYCKES application, and then spend the majority of our time talking a little bit more about the PSYCKES access protocols for obtaining access to your hospital and designating those security managers to grant access to pertinent staff, and then implementing PSYCKES in your hospital, in EDs, and inpatient settings. And then we'll make sure to leave plenty of time for training and technical assistance. And then I have an appendix for anything that we don't have time to cover today that we think would be important for hospital leadership to be aware of when it comes to PSYCKES. All right, so with that, I'm going to turn it over to Dr. Flavio Casoy, who can help share a little bit more details about the why now. So Flavio?
All right, Kristen, can you hear me?
I can.
Great. Hi, everyone. Thanks for joining. Really appreciate your time and all the work that you do. As you're likely very aware, in January of 2025, the State Department of Health updated regulations for emergency departments relating to certain individuals who present with behavioral health concerns. Very recently, the Department of Health and the Office of Mental Health have issued joint guidance to help programs implement these regulatory updates. PSYCKES can be very helpful in doing this. So one thing that's required of all emergency departments when evaluating individuals with a behavioral health presentation is to look at PSYCKES if the person's on Medicaid, and see if they have what we define in the regulation and call complex needs. That can be very easily done by looking in PSYCKES and seeing if that flag is present. It's like right there, front and center, and can really save a lot of time to determine whether or not that individual has those complex needs. For individuals who have complex needs, who are being discharged from emergency departments in hospitals with psychiatric inpatient units, that's a subset of emergency departments, not all emergency departments, and just when discharging individuals who have that flag for complex needs, there's a few additional discharge planning requirements, and sort of looking at the information in PSYCKES can also facilitate emergency department staff sort of making that happen. So for example, if individuals are enrolled in care management, the discharge plan has to be coordinated with that care management agency, and the phone number of that care management agency is like right there in the clinical profile in PSYCKES. And then also a requirement for this subset of patients is to schedule and confirm an aftercare appointment within 7 days following discharge. And psyches can show where this person might be receiving services to make it easier to locate where they might have a relationship and call and make that appointment. And then there's a requirement to send a discharge summary to that aftercare provider, and psyches can also sort of show the contact information. So there's new regulations out there, new guidance on how to implement them. Psyches can make it much easier to do this and like reduce the workflow and help your staff. So here's a training on some of those functionalities. So let me turn it back over to you, Kristen.
Thank you, Flavio. All right,
Thank
so
you.
let's go ahead and talk about, oops, I clicked too many times. All right, so why Psyche? So I think Flavio did a great job of summarizing all of the functionality that Psyches can help hospitals with. So the ability to review that patient record that summarizes over 5 years worth of data and flags individuals with those complex needs and identifying any of those existing care management programs, as well as providing contact information, as well as identifying previous providers, as well as their level of engagement and care. And it also supports real-time sharing of discharge summaries or other documents such as a psychiatric advance directive or suicide prevention plan. So those could be uploaded directly into the patient record. So just some stats that we have close to 80% of all New York State hospitals already have psyches access. So we're already off to a really great start with hospitals. And we already have over 2,700 ED or CPEP users and over 4,000 psychiatric inpatient users of the psyches application. So the next part of my presentation is just going to talk a little bit more about what Psyches is. So Psyches is a secure web-based application that integrates multiple data sources to support population health, quality improvement, care coordination, and clinical decision making. As I mentioned, it's available on the web, but we also have mobile applications. So you have the ability using a Psyches app to rapidly look up somebody's clinical information, either on an Android device or on an iOS device. So I just wanted to always give a little heads up about the mobile app that we do have available. Some of the data sources that we have available in the application, one of our largest is the Medicaid claims. So that's going to indicate information related to inpatient and outpatient services, medications, diagnoses. But something that the Medicaid data will not be able to tell us is some of the clinical documentation. So we'll be able to show what had been paid for, but maybe not the associated clinical documentation of that information. But we don't just have Medicaid data. We have data from other state administrative databases. So that includes the EMR data from the state psychiatric centers. We also have New York City-based data coming from Rikers, the Department of Homeless Services, as well as DOHMH related to MAVEN data, which would be some of the mobile crisis, AOT under investigation, et cetera. We also have information related to state OMH data. So information related to AOT, those involuntary outpatient commitment orders, suicide incidents in the state's incident management system, CARES data on high intensity outpatient and residential mental health services. So it's just not strictly Medicaid data that you'll be able to see in Psyches, not to mention the provider and patient entered information, which I was kind of alluding to in the previous slide. So being able to upload advanced directives, safety plans, and also do screenings such as suicide screenings or depression screenings. So currently in the application, we have over 12 million patient records that are reviewable in the application. And these are including individuals who have a Medicaid-funded behavioral health diagnosis or treatment, part of the state psychiatric center inpatient or outpatient services, and the health home outreach and enrollment. So here's a little summary of some of the different reports that you have available within the application. The clinical summary is that individual level report that's going to be able to identify the complex needs flag as well as what criteria that person met to meet the complex needs, care management and outpatient provider information, as well as uploading those documents. We also have quality indicator and statewide reports. So this could be helpful when you're trying to determine maybe performance, and you can review your hospital's performance compared to the region, to the state, even to other hospitals related to 7-day follow-up post-ED or inpatient, or care management follow-up post-discharge as needed. And then lastly, we have the recipient search. So the recipient search can not only identify a single client, but also a group of patients of interest. So if you're interested in the number of patients that were served in your ED that also have complex needs, you have the ability to run a recipient search to identify that population. And then we have the brief clinical summary. So this came from a high risk quality collaborative project from a few years back that some of the hospitals on today's call might have even been a part of, where we went and interviewed inpatient and ED and CPEP staff to get a better sense of how they were using the clinical summary. And based on the information they provided us, we created the brief clinical summary that acts as almost like a cover page to the entire full clinical summary. So it's pulling in the most critical pieces of information and putting into a concise way where you're able to see it all within a printed page. If that was something that your hospital was doing still, is having a printed EMR record, or sorry, medical records, or uploading into your EMR. So some of the information that you can see just on that first page alone is including that care coordination residential contact information that you can see up at the top there, notifications, so the person meeting complex needs, the reason, any of their active quality flags or diagnoses that they were given in the past year, broken out into the most recent or the most frequent, their medications from the past year, their outpatient providers, which would let you know where they've been receiving services in the past year, and then all hospital and crisis utilization from the past 5 years. So that's all available on one page with the ability to go into the full summary to get even more specific information or more details related to this information. All right, so let's talk a little bit about the PSYCKES Access Protocol. So I already mentioned that we have about 80% of all New York State hospitals with PSYCKES Access, but what are the steps that for the other 20% to follow? So the first step that any organization needs to follow when they're looking to get PSYCKES Access is to confirm that they're eligible for that access. And all DOH hospitals within New York State are eligible. So all New York State hospitals are eligible for PSYCKES Access. So we already have that step taken care of. The second step is making sure that you've completed the required PSYCKES documents. So that includes a contact form and confidentiality agreement. And we already have 80% of the hospitals who've already completed those steps. The third step is for the e-signing of the CNDA, which is the Confidentiality and Non-Disclosure Agreement, to register your hospital in what's known as the Security Management System, otherwise known as SMS. So you might be wondering why 82% of the hospitals have already completed that step if around 79% have PSYCKES Access. So the security management system is used for multiple OMH applications, not merely PSYCKES. So your hospital might have access to the NYMER system or into the CARE system, for example, for data collection purposes, but they might not have gone through the process to get PSYCKES access. So that's the difference in the percentages that you're seeing there. And then step 4 is designate and register security managers. So we have 80% of the hospitals have designated security managers, and these are the individuals who will be responsible for granting and revoking access to users at the individual hospitals. And then step 5 is enroll PSYCKES users. So again, as I mentioned, we have about 79% of hospitals already have access to PSYCKES, but you want to make sure that you have active users. It's not just enough to have access to it. You need to make sure that you have users using the application, as well as making sure that you have users in the appropriate settings. So here's just a bit of a breakout of all of the different types of users that might already have access to PSYCKES and what their service setting is. All right, so the first thing that you're going to want to do is determine what step is my hospital on. So what we have created that we will be providing all of the hospital folks who joined today's call is this Psyches Access Users table. So if you look at this table, you'll be able to look up your hospital by either the name that you're known as in DOH or in OMH. We also have the PFI code that DOH has, as well as the OMH FA code, your federal tax ID, county, address, city. So this is to help determine, I'm looking up the appropriate hospital because access is granted at that organization level. So everything that you see in blue, this is going to help give you some sense of where you are in the process. So the first column that you're seeing here, I, is saying Psyches access granted, yes or no. So if you see a yes here, that means your hospital already has access. So you can move on to certain steps like making sure you have the appropriate security managers or you're having users granted access in the appropriate settings. If that's a no, you'll just want to make sure that you're following the steps to see like, well, did I submit a contact form? And did I submit the data confidentiality agreement? And then did I sign the CNDA? So this table will help you identify what step you're on for your hospital. And for those who do have their Psyches access, you can also then check to see who are my security managers, who are the people that are going to be responsible for granting and revoking access at my hospital, because you might see that there's some names there that you want to think about. Maybe we need to add more security managers for full coverage, or we want to add certain security managers because somebody no longer works at the hospital anymore. So this is going to be the table that's provided to all of the attendees today to help you identify what step you're on. So step 1 through 3 is just making sure that you've obtained Psyches access for your hospital. If no, you'll complete those steps. And then if yes, you'll make sure that you're adding those security managers and then granting ED inpatient staff access to Psyches. So if you have any questions along the way, because I understand that there's a lot of steps here and sometimes it can get a little confusing. So that's why we're trying to give as many materials and details as we can. But if any point in time that you have a question, please contact the Psyches Help Desk, which is this psyches-help@omh.ny.gov, or the Office of Hospital Care and Community Transitions, which is hospitalcare@omh.ny.gov, who can help assist you in this process. Let's go ahead and talk a little bit about steps 1 through 3. So as we already mentioned, all New York State licensed hospitals are eligible for Psyches access, so step 1 is already out of the way. So if you're a hospital that doesn't have Psyches access, you want to see if you've already submitted or your hospital has already submitted these 2 required forms. So there's the Psyches Access online contact form, which is a SurveyMonkey form, which is going to ask for certain details about your hospital, including if it's a DOH licensed hospital or if you have OMH licensed program, what your address is, what the contact information is for your CEO or executive director, your CEO or deputy director, and then having 2 Psyches contact points. These are going to be really important people to help track the progress that you're making relative to your Psyches access. And we also need to get your federal tax ID and Medicaid provider ID because we use that information to create your view in Psyches and attribute clients that you're billing for to your view. The second form is the Psyches confidentiality agreement, which is available online, and you can submit that to our Psyches help at omh.ny.gov email address. So for this form, it's either the hospital CEO or executive director who signs, or another person who has the legal authority to bind your hospital to the contractual terms of the agreement. So this is the information that you need to submit as part of step 2. For step 3, that's when we get to the CNDA. So hospitals as well as other providers are required to sign the CNDA in order to access any of the OMH secure applications that exist in the security management system. So you'll want to make sure that you're checking, because even if you don't have Psyches access, your hospital might have already signed the CNDA in the past for some other OMH application that your hospital has access to. So you'll want to check that table that I flashed up a few moments ago to see if your hospital has already signed the CNDA, which is going to be listed in column Q of that table. If no, you would complete the rest of the steps that we have listed on this slide. If yes, you would just go ahead and proceed to step 4. So you'll need to make sure that your CEO or executive director is going to be the one who receives the CNDA email. So it's really important that you give their CEO ED's administrative assistant that heads up, especially if you're the PSYCKES project point person who's helping maintain the progress of getting your hospital PSYCKES access. So your CEO or executive director are going to receive 2 separate emails. The emails are going to be sent to the CEO or executive director identified in that SurveyMonkey, that PSYCKES contact form. The emails are sent from this email address. The timing of both of these emails are sent together and typically occur within 1 or 2 weeks after you've submitted all of the step 2 documents if you haven't done so already. And then the email subject line is important message from OMH. And the first email is going to include your login instructions, the user ID, and the link to the CNDA to provide the electronic signature that's required. The second email is the password that you're going to use in conjunction with your user ID to access that CNDA. So after the CEO or executive director e-signs the CNDA, they do that by checking a box to the CNDA terms, and that's considered the electronic signature. We do ask as like a tip or a pro tip to any of the providers who are, going through this process, especially for their PSYCKES access, is to keep that CNDA email saved somewhere in case you ever need to find it again. But if you're unable to find that CNDA email for any reason, contact the PSYCKES help desk and we will work closely with ITS, who manages this process for all OMH applications, to make sure that we can get that resent to you right away. All right, moving right on to step 4. So hospitals are required to designate security managers to manage PSYCKES access for the hospital staff, and they're responsible for requesting tokens and granting and revoking access to OMH applications, including PSYCKES. So part of the recommendations that we have is that the security managers should be maybe the same staff responsible for managing the access and onboarding to your EMR or other secure other secure clinical applications, with protocols for approving, onboarding, and offboarding staff. And that might be an easier way to have those people be the same people that are doing the security management work for PSYCKES. And we do recommend that a minimum of 2 security managers should be designated per campus. And that's just for helping with coverage. So if somebody goes away on vacation, there's not a bottleneck effect where you can't get new users access to PSYCKES, or if somebody is leaving the hospital, no longer works there, that you're not being held up with revoking their access. So again, for step 4, you'll want to check that user table that you're going to be provided to see if you already have a security manager. And if you do, you want to review who those security managers are to make sure if you need any updates. Maybe you need to add more security managers, or you need to make a change of who those security managers are. So if you have security managers and no changes are needed, you would proceed right to step 5. If you don't have any security managers, or if you do, but they require changes, you have to make some updates there, you'll follow the step in this next slide to do that. So once your CEO or executive director has signed the CNDA, they're going to receive what's known as the Security Management System self-registration email. And that email is going to be sent within 24 or 48 hours after the CEO or executive director signs the CNDA. So again, just like with the CNDA, you'll want to make sure that you're working with the CEO or ED's administrative assistant to help locate that email. So that information will be sent to, again, the CEO or executive director who you submitted the PSYCKES contact form for, and the person who signed the CNDA. It's going to be sent from that same email address. It's going to have the same subject line of important message from OMH. And the email content is going to include instructions on how security managers self-register, and includes your hospital's agency control ID along with a self-registration link. So the action step here is once the CEO or executive director receives the SMSSR email, that needs to be forwarded to any staff that's going to be identified as the security manager of your hospital. And because that it's including the self-registration link needed to register as a security manager. So again, just like with the CNDA email, we strongly recommend to save this email someplace where it's easily accessible in the future to allow if any additional security managers need to be added. So again, forwarding that email to the office that will be managing security so that they can designate additional security managers as needed. But if you're unable to locate the SMSSR email that you previously received, for any reason, you can always contact the PSYCKES help desk and we can put in a request to get that resent and help you track. So once the appropriate staff have received that SMSSR email, they are going to follow the instructions to self-register. And we have those steps detailed in the appendix of today's slides. They'll have to also activate their token. So after registering, the security manager is going to receive an OMH issued RSA token approval email, and they'll need to follow instructions to activate that token. And then we also strongly recommend that the security managers themselves grant themselves PSYCKES access. So the security manager could use that token to log into the security management system and begin creating user accounts for the appropriate staff, as well as granting PSYCKES access to those staff. And again, we think it's a great idea to grant themselves access to PSYCKES in case they can help with any technical issues or monitoring use to make sure that people are actually using PSYCKES, because we have usage reports that were also indicated in the appendix of today's training. All right, so step 5, now that the security manager has been registered, they need to start creating those new users. So the hospital identifies which staff gets PSYCKES access, and the security manager is going to begin enrolling them into SMS. So they go into SMS and they add new users and request either soft tokens, which would be downloaded on a mobile device, or a hard token. They also go in and grant PSYCKES access to new users and revoke PSYCKES access when staff resigns or leaves employment at that hospital. We also recommend that the security manager notifies staff once they've gone in and granted that access so they can expect that token email that's coming to them. So the new PSYCKES users receives that OMH issued token approval email and then follows the instructions to install and activate their tokens. And we have some details in the appendix for that, as well as some one-pager user guides that we'll be including as part of the hospital resources after today's training. Okay, so that's the process for getting PSYCKES access, but remember that close to 80% of the hospitals already have PSYCKES access, so a lot of you are already ahead of the game. But let's talk about what's needed to implement PSYCKES. It's not enough just to have access. You have to make sure that you're implementing it at your hospitals. So we have the implementation broken up into 4 sections. So the first section is plan. So making sure that you're identifying those implementation leads and you have staff who are available to provide technical support, and you've identified who are going to be the users of PSYCKES. You want to consider supporting policies and procedures to help with this guidance, as well as any EMR changes that you might want to make with maybe having a checkbox being, looked at PSYCKES or checked PSYCKES or saw the complex needs in PSYCKES, and any other technical options for consent and tokens. And you also want to make sure that you're planning the workflow to access and review the PSYCKES clinical summary and how you plan to implement that. You also want to make sure that you're prepared. You want to make sure that you have people enrolled, they're oriented and trained to use PSYCKES. And then a big part of implementation is, of course, to implement. So beginning those new workflows to access PSYCKES and review the clinical summary data in your hospital settings. And then most importantly, how to sustain. You don't want to go through all of the work and lift of doing an implementation plan and then fall short of the 1-yard line of not having a plan to sustain that activity. So a way you can help make sure that the implementation can be sustained is reviewing those usage reports. So identifying which staff are logging into PSYCKES, How many of them are looking at clinical summaries? And then ensuring security managers are aware that Psyche's access should be revoked as part of offboarding. Especially for people when you're thinking that you're using a token, it's either a keychain physical fob or downloaded on a phone. Just like you'd want to, make sure you're getting the keys to an office door before somebody's leaving, you want to make sure that the security manager is revoking access. All right, so let's talk about some of the planning considerations, starting with staff roles. So some of the important staff roles are going to be the project lead. So again, I think it's similar to the same person who, if your hospital doesn't already have access, would be that point contact person that you'd include on that SurveyMonkey contact form. So making sure that you have a lead for the implementation in the ED and inpatient services at any of your campuses. And they may want to create a work group to help support planning and implementation. You also want to make sure that you've identified the security manager. So if they were originally project managers or service directors, you may want to transition that role to be somebody who's managing secure access to, for example, the EMR. You also want to make sure that you're identifying who are going to be the users in your ER or your inpatient. So any staff can be granted access as part of their work duties. So it's really important to decide which staff you want to be able to give Psyches access to and how you plan to implement. Therefore, the security manager can get that information and begin enrolling. So the individuals who will be obtaining consent. So maybe you have an implementation plan where it's the intake desk or the registration desk that has the Psyches consent embedded in the forms, and they'll be the ones that are going to be obtaining consent and maybe even enabling consent in the application. If that's going to be part of their role, they need to have Psyches access. The clinicians and individuals who need to know whether the patient has a complex needs flag. So you want to make sure that they have access so they have the ability to look up an individual. Any trainees, so quick learners, Psyches is very helpful with assessment and clinical case presentation. You also have the ability to even de-identify if you're trying to do a presentation without showing any client identifying information. And then supervisors or others that might be monitoring implementation and use, because as I mentioned, we have those Psyches usage reports available within the application itself. It's always a great plan to identify any Psyches token experts or super users. There might be even some super users already located in your hospital. So who can help support the staff locally? As always, you'll have the access to the Psyches help desk as well as the OCT email. But if you have any people that you have already with access to Psyches that are kind of considered a super user, it might be great to have them on hand. And then train and orient staff. So identify who is going to be doing the trainings, especially when you're thinking about new staff coming in. Who's going to be responsible for walking them through, just like how you have to walk somebody through how to use the EMR, how do you walk them through how to use Psyches? And then as always, monitor the use of Psyches using those usage reports. All right, so what's another planning consideration? Thinking through the policies, procedures, documenting in the EMR, etc. So who will the patients call if they're concerned about their health data or want to withdraw consent? So hospitals typically have a patient relations office, so that would be something that you'd want to make sure is updated in the Psyches consent form. So you have the ability to indicate who those contacts should be because you're giving a copy of the consent to the patient themselves. And we have some of those steps listed in the appendix. So you want to make sure that you're identifying who the patients would call if they want to withdraw their access, or sorry, they want to withdraw their consent, or if they have a concern about somebody accessing their data. The consent forms, do you want to use paper consent or do you want to have an e-signing component? So paper, you can just print out directly from within the Psyches application. It'll have all of your hospital information as well as the contacts that your leadership has decided would be already populated, and you can print those out directly via the application. You can also e-sign using the Psyches mobile app. So that's something that we talked about before. So if you have a tablet or an iPad that you use with intake, you can download the Psyches app on there and then have a rapid way to look up a client and enable an e-sign consent. Or you can build out the consent in your EMR with electronic signing as a function. And that again is best for long term and prepares the hospital for future interoperability solutions. You also want to make sure that you're defining what that clinical emergency is. So we do have a break the glass scenario where a consent wouldn't be required in the case of a clinical emergency. And obviously, a lot of times people showing up to an ED, that's very likely one of the ways that you're going to be able to access somebody's information. So you'll want to clarify the definition for staff. And I do believe that we're going to have some forms, if they're not already announced, that can help hospitals track that information. And then you want to consider the EMR changes to help support the work. So a checkbox to identify consent is in place, building the consent into the EMR itself like we described above, or a checklist or prompts in the EMR to support documentation for clinical emergencies. And then mobile devices. Soft tokens are installed on mobile devices. So are there any policy changes that need to be considered? So if cell phones aren't allowed on the floor, but it's going to have the security manager having to maintain a number of physical tokens and deliver them to the appropriate staff, is that something that you want to reconsider? All right, and then you want to think through some of the critical tasks and example workflows. So thinking through who's going to be consenting patients. So first, embedding that psyches consent with other consent forms that are being done during intake or registration. Having triage staff consent clients when they identify behavioral health presentations. Consenting patients when they decide to call a psych consult. And having a procedure in place for when a client is unable to consent or there's a clinical emergency. Not only getting the consent, but who's going to be entering the consent. So is it going to be designated registration staff who are going to be checking if the patient already has psyches consent and therefore you don't have to re-enter that? Or the registration staff can enter the consent status for the for psyches in the application. The use of the PSYCKES mobile app, already mentioned there. Registration staff document consent in the medical record so that other staff with PSYCKES access can enter. So if it's decided that we're not going to give registration staff access to PSYCKES, but they're collecting maybe the paper consents, it'll give the other staff that heads up that they can go in and enable. We also can have clinicians enter the consent or determine those clinical emergencies of break the glass. So that's going on right into the next, determine and document clinical emergencies. So who's going to determine and how that is documented? So having a doctor or a nurse practitioner determining and documenting a clinical emergency and building a checklist or a prompt in the EMR to support that documentation. Having staff review the PSYCKES clinical summary as well as confirm if there's a flag for complex needs. So if a hospital is using a paper clipboard, registration staff could always print out the clinical summary and add to that record, or the clinical staff can always log into PSYCKES to check the clinical summary ahead of meeting with the patient if needed. And the workflow might involve multiple departments, so it's really important to have coordination and communication. So the recommended workflow that we have in this slide is that you have the PSYCKES consent embedded and is part of a routine consenting process for all ED presentations on registration, intake, and direct admission. And you'd have them consent, enter in the consent, registration staff enter in the consent into PSYCKES, access the clinical summary, and export it into the EMR or into the paper chart and alert the clinical team. The clinical team then can conduct their assessment and evaluation on the complex needs using the information in the clinical summary. So the advantages of this approach is embedding within routine consent workflows and no clinician time would be required. One of the disadvantages would be registration staff log into PSYCKES for all clients, but if they don't have a Medicaid enrolled behavioral health client, if they're not that already, it might not yield results. So it's maybe getting consents for everybody, but not everybody may be included in PSYCKES. The alternate workflow would be patient is triaged and registered, and then the clinical staff conducts a screening to identify if the patient has a behavioral health related complaint and have them go through the consent process or a clinical emergency, attest to the access in PSYCKES, print and download the clinical summary into the EMR, and then review that information for complex needs. So the advantages here is there's a greater chance that there's going to be a PSYCKES clinical summary if somebody already has a behavioral health related complaint, and maybe you've already determined that they've are part of Medicaid or had been. The disadvantage would be it's using clinical time, staff time to do maybe some administrative tasks, but these are two potential workflows. So the next thing to talk through is how to prepare. So wanting to make sure that you're enrolling the staff, so ensuring that the security managers have that list of staff to enroll, and what they're going to need is first and last name, email, and staff title. It's imperative that obviously it's great if all things are spelled correctly, but especially the email address, because that's going to be really important, because that information is going to be used to send the token activation steps. So always making sure the security manager has all of these details and they're spelled correctly. And then who's going to orient and train staff users to PSYCKES, how to use it. So you want to make sure that you're identifying individuals that are with a behavioral health crisis at risk for poor outcomes and who's going to be eligible for some of those enhanced services. That's the goal of how you're going to use PSYCKES. So having a PSYCKES overview of how to identify patients with complex needs in the clinical summary. We're going to be having 2 additional trainings this month that are going to be detailing this specifically, especially for those frontline staff. How to install a token, log into PSYCKES, and who to contact for technical support. Thinking through PSYCKES related workflow and how it reflects their role. Maybe doing role specific training could be helpful, like the role of administrative staff person versus the clinician. The definition of break the glass and how to document in the EMR, underscoring security concerns, so needing to use your hospital's token only when working at your hospital. And the way that SMS is currently organized, it's one user, one token. You don't have shared tokens. So if you work at 2 or 3 different hospitals, so you're maybe moonlighting at 2 or 3 hospitals, that means you have 2 or 3 user IDs and tokens. You cannot share tokens. All right, implement. So staff begins using PSYCKES in accordance with the plan that your hospital has established. You have token experts and super users available to assist locally. And then you have the implementation and workgroup team who help monitor those operations, identifying any challenges or barriers that you're facing, and adapt and modify the implementation plan and procedures as needed. And as always, you can contact the PSYCKES help desk if there's any questions that the team might be unable to answer. And then lastly, how to sustain these practices. So reviewing the usage reports, identifying which staff are using PSYCKES and how many clinical summaries they're viewing. You can also ensure that the security managers deactivate tokens for any of the departing staff, providing PSYCKES access and training to new staff as part of onboarding processes, and consider modifying or expanding the use of PSYCKES when appropriate. All right, so I'm going to talk through some of the resources besides today's training that we're going to be providing our hospital partners. So the hospital resource packet is going to be sent out to all of the individuals who have been trained, who are going to be attending the hospital trainings. We can also make them available upon request. We'll also be posting to our PSYCKES public website once we have these finalized and we have these trainings completed in this month. So what information does that include? So that's going to be an action planning form. So that can be helpful when you're trying to think like, where does my implementation start? An action planning form could be a good base for your hospital to use because it's basically going through a checklist. You have everything that you need to start using PSYCKES, whether it is you have security managers in place, you have a consent procedure in place, a clinical emergency documentation plan in place. So it's just a really helpful tool to kind of organize some of those next implementation steps. We also have some one-pagers for the security managers when it comes to granting PSYCKES access in SMS, as well as revoking PSYCKES access in SMS. We also have a PSYCKES consent script. So if you want to have a quick script available for when a patient asks, well, what's PSYCKES? You have a way of introducing what the PSYCKES consent is and what data would be available, as well as some frequently asked questions and responses. So you have that as, again, another one pager as a resource to help with individuals when there's questions around the psyche, what PSYCKES is and the consent. And then a PSYCKES summary checklist workflow. So making sure that you're going through the workflow of utilizing PSYCKES and getting the information that you need. Activating token and logging into PSYCKES. So this is going to give you instructions for how to activate first a soft token, which would be done on a mobile device. So going through the process of getting the email, following the steps to activate your token and get it downloaded onto your appropriate mobile device, and then how to use that token to first log into the PSYCKES application. We'll also include instructions for hard tokens. So hard tokens are going to require a little bit of coordination between the security manager and the user. So getting that hard token and then following the steps for activating that token during that first time logging into the PSYCKES application. And then also how to upload a psychiatric advance directive into PSYCKES. So steps on how to upload that documentation will be made available. So that's going to be all part of a zipped folder package that's going to be sent to our hospital partners. But we also have on our website a PSYCKES implementation resources. So this isn't going to be hospital specific, but this is available for all of the organizations who are eligible for PSYCKES access to help. So it provides some PSYCKES guidance for policies and procedures, as well as some PSYCKES core competencies checklists. So again, these resources are available for hospitals to review and maybe decide if there needs to be some adjustments, based on individual hospitals and how your, procedures and policies operate. But you can always use these resources as a jumping off point and then, make adjustments as needed. And then lastly, some of the training resources for our PSYCKES users. So we have short how-to videos, so no more than 5 minutes, that detail, a step-by-step. Sometimes people are really visual learners. So how to log into the PSYCKES application, how to look up a client and enter in consent, and how to review a client's clinical summary. So quick, few minute videos to do some of those, specific core competencies. Then we also have user guides. So user guides are for every module that we have available within the PSYCKES application. So this is, guides that can help our users enable access to client level data, looking up the clinical summary information, maybe on the mobile app information if you want to learn more about that. And then the PSYCKES training slides and recordings. So we have multiple different trainings and recordings that we give on a quarterly basis live. And then we post those recordings and training slides to our website. So you have the opportunity of either joining a live training like you did today, or you have the opportunity, if you don't have that time, but you're really interested in learning more about that specific training, that we either split up between a specific module or by a specific user type. So for example, today is for hospitals. So hospital users are the dedicated audience for today. So we have a few different trainings that are available on our website. We also have a what's new section on our PSYCKES website. So the first place that you land when you go to psyches.org or psyches.com, it's going to have a what's new. And we just had a brand new release earlier this month. A lot of the features that we added this month, we added with hospitals in mind. So the ability for hospitals to look up a client and see in a planning considerations column, like Flavia was talking about before, that this person is hitting complex needs. They hit a complex needs flag. So prior to even enabling consent, you could see if an individual is complex needs or not. You can also search for people who have been in your ED in the past year, for example, and see if any of those individuals were complex needs. So a couple different things that we've added into our application earlier this month to think of our hospital partners and how to, help ease the use of PSYCKES. So for more of those training resources, you can go to our PSYCKES website, and if there's any questions related to the PSYCKES application, when it comes to data, functionality, access, please do not hesitate to reach out to our PSYCKES help desk, which is available 9 to 5, Monday through Fridays. We strive to make sure that people are being responded to within less than one business day. And we can always set up a WebEx if needed, if there's additional or a more complicated question. And then we also encourage you to contact your OCT hospital program specialist or that hospital care at omh.ny.gov, who might be able to do an on-site demonstration for your hospital when it comes to PSYCKES. So with that, I'm going to stop here and I'm going to check in to see if we had any questions that came in.
Kristen, we did have a couple of questions that came in. The first one was, who do you recommend should access PSYCKES in the ED, specifically off shift? And I did ask for additional details on the off shift piece, but I did not hear back yet. So if you want me to do some follow-up on that, I can.
Well, let's see, Flavia, what are your thoughts on people in the ED who are off shift accessing PSYCKES?
I mean, I think every emergency department has, I mean, you've seen one, every emergency department sort of functions differently. There's different workflows, different staff have different responsibilities. So I think like the answer to that question is going to depend on, what the procedures and the processes and the workflows are. We would be happy to sort of have a sort of a more detailed conversation with the program leadership on like what are the particulars, and maybe we can offer assistance on sort of thinking about how to implement a workflow that works in your context. But it's hard to answer without knowing more about how are other sort of regulatory requirements fulfilled right now.
That makes a lot of sense. So Michelle, let's take down that user's information and get them connected with the OCT hospital care group to, help figure out what next steps would look like.
All right, that sounds great. Thank you both. The next question is, can you share an example of a PSYCKES policy for non-OMH hospitals?
Oh, I think I might need a little bit more detail about when we're talking about a policy for non-OMH hospitals, because I
Mhm.
think what you're I'm not sure if I'm following that one 100% because I'm not sure what the differences would be for some of the different steps that we have here, right? For all hospitals are supposed to be checking for complex needs, for example. So the policy for looking up an individual or identifying the staff who are going to be responsible for, collecting consent, those should be pretty similar between the two.
Or maybe, Kristen, the
Hmm.
question is, do we know of any, um, you know, Article 28 licensed emergency departments that have a model workflow or model internal policy that, that we could share and that maybe people could learn from or adapt? Maybe that's what the askers, the person asking that question is looking for. And maybe we can sort of think about and see if we can find an emergency department that has implemented this. What does their workflow look like, and we can ask permission if we could share with others.
Yeah, so what we could do on the psyche side is we could identify hospitals that A, already have PSYCKES access, B, already have PSYCKES users in the ED settings. And then if we want to connect with the OCT folks on reaching out to that hospital leadership to see what kind of policies or procedures that they put into place that made it a successful implementation, I'd be more than happy to share that information and take that, those next steps with OCT.
That sounds great. Thank you. I've taken a couple of notes on the next steps here. The next question is, our hospital is a smaller affiliate hospital of a larger medical system. The larger medical system has PSYCKES access. Does the affiliate hospital also need hospital-specific PSYCKES access?
That's a great question. And the way that we approach access to PSYCKES is going to be based on that federal tax ID and Medicaid provider ID combination. So that's where that user table is going to come in really handy. So I think for this user, once you get access to that table, look up their hospital and see if you are already like under the auspice of that larger medical system, or if you have a separate tax ID, then you would be considered getting access on your own for your own hospital. So I think it's, hospitals are very complicated when it comes to the organization. So that's why we created that PSYCKES user table to help hospitals identify, like, am I supposed to be getting access under the hospital at large, or is this like, because we have a separate tax ID and we bill under this Medicaid provider ID, that we have our own separate FA code or PFI for DOH, and therefore we would have to follow those steps. I think that table could come into really good use for that use case.
Thank you, Kristen. That leads into our next question. How do I find the list of hospitals that have access to PSYCKES?
Great question. We're going to give it right to you. So after today's training, I'm hoping sometime this week, we're going to provide you the materials that we talked about during the earlier part today. So not only, I'm going to just jump back on one slide here, but not only will you get this hospital resource packet with all of this information, with the slides, with the recording link, but you'll also get the table that we reviewed earlier, where you can use this information to identify your hospital and see if you have PSYCKES access, and if not, like what step that you need to be, following that we discussed earlier in today's training.
Thanks, Kristen. A couple more questions just came in on the PSYCKES database functionalities. One of them is if a patient moves off of Medicaid to a commercial insurance plan, will they still appear in the PSYCKES database?
Yeah, that's a great question. So once in, always in when it comes to Medicaid. So we might not be, so if they're no longer, having a managed care plan with Medicaid or a fee for service with Medicaid, we might not be able to use this as one of the data sources, but we'll have information for them, and we could, like, from their previous Medicaid data, as well as any updates related to the other OMH application details that we have. So if they've had, let's say, for example, a stay in a New York City Department homeless shelter, we'll be able to update that clinical summary with that information. Or if they've had, a stay in OMH residential housing, we'd have that information. So when it comes to the Medicaid details, it's like once in, always in. It's just that we wouldn't have Medicaid as an ongoing data source if they're no longer part of Medicaid.
Thank you, Kristen. Just two more. We might need to maybe follow up on this next one. It's a specific use case, but this person works in a freestanding ED, and their priority is to get the patients into a CPEP program. Is there any way PSYCKES can help in that situation?
That might be a little too specific for me. I don't know for you, Flavio.
Yeah, I mean, so psyches can give a lot of very useful information. So, for example, you can look in psyches to see, what's the pattern of utilization? How often is this person hospitalized? Is this person someone who had been on a long-acting injectable and seemed to have fallen off? There's a lot of, the information is based on administrative data, but it can help give a clinical picture of the person, and sort of get a sense of what could be the level of risk, what could be the um, what are the needs, or maybe in addition to a behavioral health presentation, this person might have been in treatment for HIV, but that seemed to have fallen off, or maybe there's sort of other occult medical needs that um, you know could be contributing to why the person sort of has challenging behaviors in the community. So it's clinically very useful for any assessment, especially when sort of communicating with the nearby CPAP on how to do that transfer.
Thank you,
Thank you,
Flavio.
Flavio. And the last question is about the PSYCKES reports. I think it was slide 9. Somebody had asked, can you review those topics that have reports already written, like the clinical summary, the quality indicators, and statewide reports and recipient search? And I think the slides might be helpful for that, along with some of our other PSYCKES training materials, Kristen, but I didn't know if you wanted to add anything to the reports that already exist in PSYCKES.
Yeah, I think like again that one slide I had shared earlier it talked about some of those details, but I can give a little bit of an overview of what's going to be available in the usage reports specifically, which that slide earlier on didn't specify. So some of the information you're going to be able to use to monitoring usage at your hospital would be the PSYCKES users. So that'll show the number of PSYCKES users at your hospital, which staff have never logged in, and what service settings the PSYCKES users are a part of. You can also do a PHI access, which would identify the number of signed consents that have been entered in during the reporting period, how many times emergency level access was enabled, and the staff details who are doing the enabling of patient level details. And then you can also see clinical summaries. So how many clinical summaries had been viewed, the users who are accessing those clinical summaries, and how many times the clinical summary was accessed. So example of the PSYCKES usage would be you'd have your hospital here. You could pick the date range of your choice. And then if you wanted to focus on a specific service setting, you could choose that down here. And then you could see how many people have logged in, how many unduplicated clients those individuals had been able to view, how many total users you have, how many are active versus how many have never accessed. And then you'd have user details down below for each specific user to be able to identify that information. So that's going to be all part of the appendix that will be included in these slides. We just didn't have enough time during today's training to review all of these details. But I think this is a good place to stop. We're right at 12. So again, I want to thank everybody for attending and participating during today's trainings. As I previously mentioned, the recording, training slides, and other hospital materials will be provided to all people who attended today's training. And we're going to be working towards getting those materials up to date on our public website. And then we're hoping that we're going to get just as a great of a turnout for some of the other trainings that we have upcoming in the next week or two related to how frontline staff can use PSYCKES. But until then, please do not hesitate to reach out to our PSYCKES help desk or our OCT colleagues if you have any other questions and concerns. And again, I just wanted to thank everybody for joining us today. Have a good one.